here and there. So welcome to our fourth webinar, I guess it is, that we are presenting to you guys on this evening. So this one obviously is on knee pain. So we have a full evening of information, hopefully, that will be helpful for all of you. So feel free, we do have the Q&A boxes and the chat boxes open. So as we're going through, if you guys have any questions, comments, anything that you want us to address, feel free to use those boxes. And while one of us is presenting, the other one of us will be addressing those questions and taking care of all that. So feel free to use that and help communicate with us. And we will get started here. Maybe. So some of you might know me. I recognize some of your names, but I am Jen Vermost. I'm one of the physical therapists here at Resolve PT. Sorry for the phone ringing. Minor technical issue. Minor distraction. So sorry for that. But I am Jen Vermost. I'm a physical therapist. I've been working in PT for a little over 16 years now. A majority of my experience is in the outpatient orthopedic world. So I have treated a countless number of people that have dealt with various types of knee injuries. And the knee is actually one of my favorite things to treat. So I am super excited about this topic this evening.
And I'm Maddie. I'm a PT as well. I'm new to Bend, so just moved here over the summer and have been working here at Resolve since, November, I think. So yeah, very excited to talk to you guys all tonight. Okay, so basic outline for tonight, we're gonna kind of cover some really simple anatomy just so everyone's kind of on the same page. We're gonna go through a few common diagnoses, things that contribute to knee pain or put you at risk for injury. We're going to talk about how PT can help, and we're going to go over some exercises and some strengthening exercises that really target the knee. But we need to talk first, pun intended. Go ahead and tell us in the chat what makes your knee hurt. And then hopefully we can try and talk about it today.
Let's see, running. Running is a big one.
Lots of runners out here.
Hiking downhill.
Downhill.
Stairs. Bending more than 90 degrees.
Okay.
Oh, we got some injuries. Looks like a history of some injuries in here too.
Okay. Cross country skiing.
A lot of really common complaints.
Right.
Yeah.
Awesome. Well,
okay.
Sounds great, guys. We're going to talk about pretty much all of this stuff. So we'll get started. So basic anatomy here. So this here is your femur, your big thigh bone, your tibia, and your fibula, and your patella or your kneecap. So this is the front view of your knee, and this is kind of the back. So this is the back of a right knee over here. So same bones, fibula, tibia, femur here. And then we have the ligaments of the knee. We have the ACL and the PCL, which they're kind of tucked deep in here. You can see right there, there's your PCL. Those help with the anterior and the posterior translation of those bones. So they kind of help keep them together that way. Your LCL and your MCL. So LCL is here, it's your lateral collateral ligament, and it helps keep your knee from kind of bowing outward to the side. And then your MCL is your medial collateral ligament, and it helps to do the opposite. So it helps you from bowing inward. And then you have your meniscus, which you can see, this is your lateral meniscus. This is your medial one over here. And those help with joint congruity, kind of giving you more surface area, more stability, and also some shock absorption. Muscles. Everyone I'm sure has heard of the quads. That's this muscle group right here. Quads is made out of 4 different muscles. So you can see 3 of them here, and then there's one deep to this guy right here. And those muscles help us straighten the knee out. Hamstrings is the muscle group on the back of your thigh, and they help to bend your knee. So that's these guys here and right there. Gastroc and calves. So your calf muscles are made of 2 muscles. Your gastroc, which has 2 heads right here. And then deep to that, just underneath there is your soleus. And those, of course, help you to point your toes. So we highlighted these 3 muscles here because those are ones that cross your knee joint. So they can commonly cause pain or get weak, or like get really tight and can cause some knee pain. And then we have some other smaller musculature that helps do some finer movement, but we'll talk about later. Okay, so tell us what kind of knee pain you have. We put up some words to kind of spark your thought process here. These are some common complaints of knee pain, and we'll talk about in the different diagnoses what's common and whatnot.
Achy is one.
Okay.
Dull. Mix of many. Sharp, tight, grinding. Achy, wobbly. Lots of grinding.
Grinding.
We'll talk about that.
We will.
Locking up, sharp. Clicking, that's a good, clicking happens.
Ooh, that was a new one.
Atomic Chernobyl destructive. That's a new one.
Wow, that does not sound pleasant.
That sounds intense. Yes.
Okay. All right. So
perpetually grumpy.
Perpetually. You guys have a good vocabulary. Okay, so starting with some common diagnoses. OA, huge. So common with OA, you'll get stiffness, achy, that dull pain. It's usually worse in the morning because we haven't moved in a while. It feels stiff. Usually kind of loosens up a little bit when we get moving throughout the day. So osteoarthritis, it's when our cartilage, we have cartilage that lines our bones. So not the meniscus, but you have hyaline cartilage that lines the joint spaces, and that can break down, especially as we age. That cartilage loses elasticity because it loses water content, and then that starts to kind of degrade. And then that's where we get kind of that bone exposure, and you hear that bone on bone commonly. But then, so we have that breakdown, and then sometimes we get some bony changes as well. So this is a normal knee. You can see this nice floating space, looks so healthy, so cushiony. And then over here, you can't really even see through the joint, right? That space has narrowed so much. You can see how bright white the edges are, and that's because our bones have tried to lay down more bone. It's trying to increase the density so that we can tolerate the force of loading that we're trying to do. It can be associated with deformity such as like a varus or a valgus knee, which is like the bow-legged or the knee knocked, for common terms. But like this image kind of looks scary. That's okay. There was a study that was like, that looked at people over 60 years old, and 100% of them had histological changes. That means that cartilage had changes at the cellular level. It was different than a young, healthy tissue. Of all those 60-year-olds, 50% of them had changes on an x-ray like this, but only 40% of them were having symptoms. And then we can get the cracking and the deep crunching. Sometimes we can get these like little loose bodies. Either that hyaline cartilage is breaking off and kind of floating around in the joint, or we can have like little bone flakes pop on off and hang out in the joint, and those can crack and crunch, and sometimes they can be a little noisy. Common signs, we can have decreased range of motion, locking, grinding, popping, and occasional giving out is pretty common as well. So that's a broad overview of OA. Moving on to meniscal tears. So we talked about meniscus, that cushiony little pad sits on our tibia, increases that surface area of the joint, gives us more stability, more cushioning. These are some common different types of meniscal tears. Usually, the smaller the tear, the smaller the symptoms. So this guy's pretty small. Probably doesn't have too much pain, maybe a little bit. Meniscal tears usually happen when we are foot's on the ground, our knee is flexed, and we have a rotational component. That's a common meniscal tear presentation. And you'll have some pain or tenderness inside the joint, right on the joint line where the bones kind of meet. You could have some swelling. Sometimes it'll swell like immediately after, or if you've been doing a whole bunch, you can get some some swelling to happen. And then also with meniscus tears, we are going to see some of those changes with aging as well. As we age, our tissue loses that water content, things become less elastic. So that's another risk factor for a meniscal injury. Very common with these is locking and catching. And that's because you have like that little meniscal flap in there kind of getting caught. Okay, ligament strains and tears. So this is kind of the basic grading scale. Like a normal ligament, a grade 1, we've just kind of overstretched it to the point where we have some little tiny tears in there. We'd still have some pain with that. And then again, as we go further up the grade scale, we'll have more pain, more symptoms, more swelling. And then, oops, sorry about that. And then location varies based on what ligament. So we talked about the lateral and the medial LCL, or the collateral ligaments. So on the outside or on the inside of the knee, usually you're going to have pain right over those ligaments, and then a little bit deeper with an ACL or a PCL, and you'll probably only have pain if you're in the partial tear region. A complete rupture, you probably won't be feeling too much pain. But very common to feel wobbly, unstable, giving way. And it's also really common to have a combo of a ligament injury along with a meniscal injury, because a lot of meniscal injuries happen with rotation, and same with these ligamentous injuries. So that's a pretty common thing. If you're kind of like, I feel like I'm kind of in between these two, it could go either way. That's pretty common. So don't be too mixed up over there. And then another thing with ligamentous injuries is that they're pretty common to re-injure. So if we have grade 1, grade 2, we're feeling some pain, and then it gets better after a few days, we're feeling good, and we go back out and we do our fun cross-country skiing, or we go on a hike or go running, and then it's hurting again. So that's a pretty common thing too. Okay, patellofemoral pain. That's going to be the pain right behind that kneecap or right around it. And that's going to be worse with repetitive activity like running, or prolonged sitting. It's going to hurt when this ligament, this quad, this is where the quad's attached to your patella. When that's loaded, that's going to stress this joint, this patellofemoral joint, and it'll hurt if you have patellofemoral pain. So usually really common in runners. You'll have pain with steps, squatting, jumping, pretty much loading that patellar joint on a flexed knee usually. And it's pretty common to be coupled with some hip weakness as well. Okay. What about my cracking, noisy knees? Everyone comes in and they're always concerned that their body's making noises, right? Everyone has like a knee that pops a lot, or my shoulder clicks sometimes. And there's some pretty common causes. So it's likely arthritis. Like I said, you can get some of those loose bodies that are in the joint that are going to make some noise, or it can just be gas bubbles, like little nitrogen bubbles that pop. It just happens. We have little gas bubbles in our joints. They're going to make some noise. And it could be injury related, but usually if there's no pain associated with the popping, then it's nothing to really stress about. Okay, Jen's taking over.
Yep. Okay. Do a little shuffle here. So that was just a few of the most common diagnoses that we see. It is certainly not an all-encompassing thing. We could sit here and talk for an hour or two just on diagnoses that we see in general. So that, again, was just some of the main things that we see here in the clinic and the things that occur most frequently. So I'm going to touch on some of the contributing factors of why some of these things develop, and why you can end up becoming injured as well. So we have to look at any history of trauma or a current trauma to the knee. So especially if you have a previous history of a pretty significant trauma, maybe you fell as a kid and busted up your knee or things like that. We do see a higher prevalence of arthritis that develops after you've had a meniscus tear or a ligamentous tear. Ligamentous more so referring to like the ACL. So in those types of traumatic injuries, we do typically see an arthritic type condition onset a little bit earlier. So sometimes that is a contributing factor to developing pain over the course of time, is just a previous history of a traumatic injury to the knee. The other big one too is with obesity. So, and all the things that we do on a daily basis, whether that's going up and down steps, squatting down, picking up something off the floor, sitting for a long period of time, all these things that put extra force on the knee, the extra weight that we carry in our bodies can contribute to that force as well. So, doing those normal everyday things, typical forces can be anywhere from 2 to 5 times higher than our normal body weight. So if you add on a situation where you're carrying around extra weight, you are again increasing those forces that are going through the knee joint. So research has actually proven that even just a sustained weight loss of 10 to 15 pounds in obese younger people can lead to a decreased risk of developing OA later in life. So, obviously trying to maintain a healthy weight and an active lifestyle is very important to the integrity of your knee joint. So that's definitely been a big one too. And I think the most prominent thing when it comes to knee pain or injury is just insufficient strength. So not having enough strength to do the activities that you want to do. So our bodies require sort of this baseline level of strength, or I like to call it this foundational level of strength to do normal daily activities. And so if you kind of think about like a house being built on a foundation, if the foundation is, if it's a rocky or a poor foundation, then the house eventually is going to crumble. The same thing applies to just baseline level of strength. You have to have a baseline level, a good solid foundation of strength in order for that to carry over into higher level activities, meaning like hiking and skiing and running and all these other things. If you don't have a good baseline level of strength, it's going to make all those activities that much more challenging and put you at that much more of a risk of developing an injury. So the biggest thing is you just have to be strong, and not only in the knee, but also in the hip joint as well. because as with everything in the body, that's all connected. And so the hip actually largely controls the knee and kind of helps to control the lower leg. And so having great hip glute strength is important for a healthy knee as well. Another big contributing factor is not having good balance, or what we call proprioception. So proprioception is a big fancy word that we like to use. That's basically just your body being able to tell what's happening. So you being able to recognize, is your knee falling inward? Are you unstable? Those types of things. So just having a great body awareness is really important for preventing injury. And ironically, having, like Maddie touched on, having a previous injury, especially with a meniscus issue, or a ligamentous issue, can really affect proprioception. So we have all these little teeny tiny little receptors that are inside the knee joint and in the ligaments and things like that. And if you have an injury, sometimes that proprioception or that body awareness can get thrown off a little bit. And so if you don't work on that and really work on the stability, and you continue to have that lack of proprioception or that lack of body awareness, can actually predispose you to re-injuring that area too. So this is something that we work on a lot in therapy in terms of balance and stability and standing on different things like foam or using like a Bosey ball and those types of things. Balance and proprioception and just overall control through the leg is very, very important. So not having that obviously puts you at a higher risk for injury. If we're talking about specifically running related, there's a lot of things in terms of running. Running is a very complex movement. There are a lot of things that can contribute to knee pain with running as well. One of the bigger ones being a cadence issue. So if you have a slower cadence when you're running, meaning that your feet are moving a little bit more slowly, has nothing to do with how fast you run. It has everything to do with how fast you move your feet, which are two different things. It sounds like the same, but it's actually not. So having a slower cadence or not moving your feet as quickly when you're running increases the force that's going up through your knee joint, which can in turn put you at risk for injury as well. Working on running cadence and form and things like that is something that we do quite often here. And so that's something that certainly, if it's addressed, can help decrease pain with running. I think the biggest, most simplest thing to look at too is just overuse. You know, if you're doing too much too soon, if you're starting a new activity, something you've never done before, and you just go out, let's say you've never skied before, and you just go out and you decide you're going to ski all day long, and then you wake up the next day and you're like, what was I thinking? And so a lot of times that happens if you're not gradually ramping up the intensity or the dosing of the activity, meaning, you know, it's like an all or nothing thing. If you just jump right in, you've never done something before, yeah, you're going to be sore, and you could put yourself at risk for some injury with that too. So overtraining is a big thing where, you know, sometimes your body just needs a break. Your body needs a rest day. And so if you're constantly pushing your body to the limit, you really are putting yourself at risk for developing knee pain or an injury too. So kind of getting some guidelines on proper ramping up of activity can certainly be helpful to preventing knee pain. Some other contributing factors too. Let's talk about pronation. This is a big thing that happens a lot in the clinic, and you know, everybody's like, I pronate. We all pronate. Pronating is a very normal thing that happens. It's part of the normal gait cycle. So when you're walking, you normally go from a supination to a pronation position. We all pronate to a certain degree. It's part of the normal movement with walking. Where it becomes a problem is if you are an overpronator. So if you have overly flat feet, that's where the whole mechanics of the lower leg really, really change. And so this graphic, it's a little intimidating to look at this, but it's a great depiction of what happens if you have really flat feet and you're overpronating. If you start kind of from the bottom up here, so you look at the foot, and if the foot is really, really flat, sits flatter to the floor, basically what happens is your ankle and your foot kind of fall inward. That makes your tibia bone or your shin bone kind of rotate or kind of turn inward, which in turn kind of pulls your knee inward as well. And so that puts you at a risk of developing some knee pain. We see this a lot in runners actually, but typical just overpronation. It changes the whole mechanics of the lower leg, which in turn kind of resonates up through the leg. And unfortunately, a lot of times the knee kind of takes a beating when you are an overpronator. It takes the brunt of the abuse. And so just working on some overall mechanic things, strengthening of the feet, working on, again, some of the hip strengthening stuff. Sometimes we do actually recommend orthotics in some situations. Other times they're not necessary. It really just kind of depends on all of the mechanics that are happening in the lower leg. But overpronating definitely can be a contributing factor to knee pain as well. That kind of ties right into some biomechanical things too. And so one of the things that, especially when we're talking about that leg kind of turning inward or rotating inward, is that mechanism actually puts you at a pretty high risk of tearing your ACL. That's kind of the mechanism of injury, is you just get this rotary force inside the knee. And so working on some mechanics of the leg really can help with that. So we have this fancy word that we use. It's called dynamic valgus. Basically, what that means is you're getting too much inward movement of the knee. And again, valgus of the knee, or that falling inward of the knee, is normal to a certain extent. It's when you see that motion becoming excessive is where the problems start to develop. And so that's one thing that we can look at and evaluate is how you're moving and the mechanics of your lower leg and how that movement is going to impact the knee. Because again, unfortunately, the knee kind of takes the brunt of the abuse. So kind of working on those mechanics, trying to get that leg to be more stable, all of that is so important to helping to prevent knee pain or eliminate knee pain too. The next one is my favorite debate to have with people, is the squat technique. So is squatting good or bad? We hear this question all the time. And so that's one thing we're going to talk about a little bit here. So pop quiz is, let's ask you guys this, and you can answer in the chat box. Maddie is over there fielding the questions. So here's your quiz. So proper squatting technique is described as A, your knees should stay behind your toes. B, that your knees and toes can be aligned. Or C, knees can go past the toes. So what do you guys think is the proper technique for squatting? We are curious to know.
We're getting lots of A's and B's, 1 C. Lots of A's and B's.
Okay.
Seems like
A's and B's.
A's and B's. Yep.
Okay. Okay.
Yep.
A's
More
and B's.
More
A's and B's.
Yep.
Okay. A's and B's. Well, guess what? It's really all or none of the above, because quite honestly, squatting just depends. And as therapists, this is one of these phrases that we say a lot, because it really does just depend. That was very much a trick question. So
Gotcha.
I take credit for that one. The reason being is, let me go back here. The reason why it just depends is, have you ever tried to go down the stairs without letting your knee go past your toe? It's impossible, because when you go downstairs, your knee goes past your toe. And that's one of those things where you do it on a daily basis and it doesn't cause a problem. So it's a very functional thing that does not necessarily damage the knee or, anything like that. It's part of normal movement. Same thing. If you have little ones at home, or maybe your grandkids, you go to squat down to pick up your grandkids, guess what? Your knee probably is going out in front of your toes. And typically that's probably not a problem for a lot of people. It's something that you do on a daily basis. Think about doing yard work, picking up sticks in your yard, those types of things. So contrary to kind of what we've all been told through the years, is that your knees should never go past your toes. It really just depends. And so it's different for everybody, but those are just some examples of when your knee actually does go past your toe, and it can be okay. Where we start to run into issues is, if you're doing squats and lunges and things like that, that's where some more of that knee pain can develop too. But in general, as a whole, when you're doing those, functional daily things, most of the time it's not going to be, problematic for damaging the knees per se. I mean, you can have pain with that, but it's not specifically doing any damage to the knee. So it really just depends. And it's so independent based on every person and the knee pain that you're experiencing. So we are going to talk about squatting technique. And again, this picture here is really good. I think it gives a great demonstration of usually the two types of squatting that we see. The first one, or the picture over here on the left, we typically refer to that as a quad squat. Basically what happens is when you go to squat down, you can see with her knees are going, pretty far past her toes. That kind of squat technique can happen for a couple different reasons. Sometimes it can happen because you just don't have sufficient glute strength. So if your hips and your glutes aren't strong enough and stable enough to help you perform a squat, and then sometimes you'll naturally just kind of shift your legs forward. Where this becomes problematic is if you're having anterior knee pain or pain on the front of the knee. Typically doing a squat like this does not feel good in that situation, simply for the fact that when you squat more like this picture here, you really are putting a lot more force through your kneecap or your patella. And if you have a history of pain around that patella as it is, this is not going to be something comfortable for you to do. So typically what we do is if you're having like anterior knee pain or just pain with squatting in general, we try to shift you more towards this picture here and utilizing your glutes more, simply for the fact that shifting your knees backwards can alleviate the pain that you're experiencing during a squat. So again, a lot of what I said earlier with the hips really kind of control the knees, and the hips really are important for good knee health. So this is one of those examples too of where just kind of shifting more towards that glute squat can be helpful for alleviating knee pain. Again, when you're seeing the knees go past the toes, if you've ever watched, the example I like to use is people who do like Olympic weightlifting or powerlifting. There are certain moves that when you're doing those types of things, your knees do go past your toes. So it's not an end all be all. It's not that it's a bad thing. It really becomes more into play. If you're having knee pain when you're doing it, then there's probably something that we need to change with your squatting technique. So as a whole, knees past the toes, it's not as a terrible of a thing as it's been made out to seem, but it is important to consider when you are having knee pain. It is something that probably needs to be addressed to make sure the mechanics look okay. Okay, so one thing that we did, if you registered early for the webinar, we sent out, I think it was a text asking for specific questions that you had. And we got some great feedback. We had some very specific questions, but we had kind of a overwhelming majority of people were kind of asking a lot of the same questions. So we wanted to address these. So here are a few of the ones that were commonly asked. So the first one, are steps bad for you? No, we do steps on a daily basis. It's part of what we do. Even if you don't have steps in your home, you're stepping up and down the curb, you're stepping over things. I mean, steps are a normal part of daily life. Are they inherently bad for you? No. Are they painful for some people? Yes. And when that is coming into play, that's what we need to look at and consider is, why are steps painful? What's preventing you from being able to do them pain-free? And those are things that we need to address. But as a whole, doing steps is a normal functional daily thing, and they're not inherently bad for you. Is kneeling bad? And this is one of those examples where I'm going to say it just depends, because it really does just depend. If you're kneeling down short term, to pick something up off the floor, you have to get something from underneath your bed, or, you're kneeling down for a very short period of time, inherently that is not usually an issue. I do recommend if you're kneeling down on a hard surface like concrete or things like that, put something under your knee. Be nice to your knee. Give yourself a little bit of padding, even if you're kneeling down for just the short term, because kneeling does involve a lot of compression through that patella, through that kneecap. And there is cartilage on the backside of your kneecap. And so if you're kneeling frequently, or you're kneeling and you're staying on your knees for a long period of time, you definitely need to invest in some good solid knee pads. So a lot of guys that we see that work in construction, or do concrete work, or anything where you're just really kneeling down for a longer period of time, you have to protect those knees. So again, it's one of those where kneeling can be painful in some instances, depending on the specific pathology that you have going on in your knees. Other times people can kneel and they're totally fine. So it just depends. Um, Very vague answer, but it really does just depend. So the next one, we hear this a lot, that running is so bad for you. Running damages your knees. You should, all runners are going to have arthritis at some point in their life. I am happy as a runner to say that is completely false. So we do not have any research that can prove that running physically damages the knees. So if you are a runner, there's nothing that's proven that says you're going to develop arthritis or things like that, for a couple of reasons. Typically people who run are very active people. They tend to kind of live a healthier lifestyle. Maybe they eat well, maybe they hydrate well. They tend to have lower inflammatory markers in their body because they are runners, and they're more active with this vigorous level of activity. So people who run typically tend to, as a very big generalization, tend to be healthier. And so we don't see a lot of those secondary factors working into the mix. Again, where this is going to be more of an issue is, do you have something going on in your knee that is making running painful? If that's the case, yes, running is going to not be comfortable for you, but that's kind of a separate little instance. If you have some sort of pathology happening in there, a meniscus issue, running might not be comfortable in the moment, but typically you can gradually progress back to it. But as a whole, when people say, does running cause arthritis, or does running damage your knees? No, we don't have any evidence that proves that running damages the knees. A lot of time running is uncomfortable because there's something else happening. That's a very controversial question. So we get that one a lot too. So I'm happy to debate that with people and just educate people, because I feel that a lot of these things we've been kind of hounded on over the years, and we just don't have the evidence that supports it. And so a lot of what we do is educating people on what's appropriate for them. And so kneeling might not be appropriate for everyone. Running might not be appropriate for everyone. But as a whole, it doesn't specifically cause damage per se. The other one that we got, the other question was supplements. The glucosamine chondroitin, the magic pill that we all thought it was going to be. Unfortunately, research doesn't really support it. In everything that we've looked at, nothing is overwhelmingly supportive saying that supplements are helpful. From a clinical perspective, just in what we've seen, and over my experience through the years, even though research doesn't specifically support it, I will have patients who take it and they report that they feel like it's helpful. So that one kind of goes either way. Again, this is one that could definitely be debated back and forth, but research just really isn't overwhelmingly supportive for taking supplements. And you do have to be careful in taking glucosamine chondroitin if you have, if you're taking other medications and things like that. So that's one thing where I always defer you back to the doctor. If you're considering taking any kind of supplement, you need to run that by your healthcare provider. But again, research just isn't really supporting one way or the other with the supplements. And the other question we got is, when should I see a PT or a surgeon? Well, this one I will tell you, when should you see a PT? Right away. If you're having any kind of knee pain, if you're experiencing any kind of limitations in daily activity, or, recreational activities, see a physical therapist right away. We are highly trained in evaluation and, diagnosing things. And so a lot of times too, prevention. Unfortunately, with the way our healthcare system is we do a lot of, reactivity, meaning we don't really address things until there's a problem. Sometimes addressing things before there's a problem is a more effective way to go about it. So there's always a great time to see a physical therapist. Just because you can get an evaluation done and we can say, hey, everything looks good, you're on track, maybe add these to your, these exercises to your current regimen, but everything's a-okay. Or we can assess the knee and look and say, ooh, we see this happening. There's never a bad time to see a physical therapist. When you're talking about seeing a surgeon, I think that depends on the particular situation. Again, depending on the pathology or the symptoms that you're having. If, you experienced an acute traumatic injury, maybe you felt a pop, or, a sudden pain, still, having the knee evaluated by somebody right away is the best way to go. Whether that be, an urgent care or a PT or something like that, getting it looked at so you kind of get an idea of what's happening. That way we can prevent further injury and get a better idea of what's occurring. So typically from a physical therapy perspective, when we recommend seeing a surgeon is, if you've been coming to therapy and we're not really seeing a lot of improvement, symptoms are persisting, we feel like you might need something a little bit, secondary evaluation, then we usually recommend seeing an orthopedic. So kind of a long-winded answer on that one, but there's never a bad time to see a physical therapist. So even if it's just a one-time visit, we check things out, we tell you, you know what, you're good to go. We don't think you need to come back. There's never a bad time to have the knees evaluated. So that leads me perfectly into what PTs can do to help you. And so again, and what I was alluding to on that last slide is physical therapy is one of the most conservative things that you can do. Nothing we do is invasive, meaning we're not, doing injections and things like that. And so we are a very conservative treatment. And oftentimes too, even if you have some type of knee injury, most of the time you see a doctor, they're going to say, go see a physical therapist anyways. And so we really are great at being one of the first steps in the path to recovery and also in the path to prevention as well. We are very highly trained in what we do. We're known as the movement experts. We're great at analyzing movement. And again, kind of going back into those mechanics with how you're moving. We can address any pain issues you're having, any limitations, on a daily basis. Take all that into consideration and kind of brainstorm with you to figure out how we need to get you feeling better. And so improving your overall function, whether it's day-to-day things, whether it's recreational activity, our job is to keep you moving or get you back to moving. We want all of our patients to be active and healthy and to be able to do the things that they want to do. And so that's our goal, is to help you feel better and move better. So one of the things that we like to do, especially when assessing the knee, depending on what your symptoms are, what you're complaining of, is we have this whole battery of special tests. So we have all these little tricks and things that we can do. We can check ligaments, we can check the meniscus, we can check all these different structures of the knee, which gives us a pretty solid idea of potentially what's happening inside that knee joint. So special testing is a big one. We do it to either confirm what we think is happening or to kind of refute what we think is happening. So it helps us to kind of rule in or rule out things and kind of narrow down what's possibly going on inside that knee. The other thing we do, strength and stability testing. So looking at the strength of the leg, of the hip, looking at your overall stability, give you specific exercises that are really tailored to what you need and what are appropriate for you, given your current level of function, given current, level of pain, those types of things. So exercises that really are tailored specifically to meet your particular needs. And again, going back to assessing the movement patterns, looking at squatting and jumping and those types of things. Here at Resolve PT, we have movement sensors. It's called DorsaV. We're one of 2 clinics in the entire state of Oregon that have it. So DorsaV is a great sensor technology that we use that better helps us to assess movement. If you're a runner, DorsaV works great for that. We also do video gait analyses. Basically recording you as you're running and kind of breaking down your running form. And so we do a lot of analysis of movement and kind of determining what we need to do to help you move better and prevent injury. And the other thing we do is we call it ASTIM, or Instrument Assisted Soft Tissue Mobilization. We'll talk about this in a little bit. I do want to touch on the DorsaV just a little bit more because it is so unique to Central Oregon here at Resolve. What DorsaV is we have these 2 tiny little sensors, and you can see on this picture here, there are 2 sensors that get attached right to your shins. And basically what it is there's a couple different pieces of technology inside the sensor, and we're assessing movement in all different ways. And what we're looking for is symmetry between your 2 legs. And so how is, the right leg moving in comparison to the left leg and vice versa. And so these movements that we're looking at are very minute. You generally can't see it with the naked eye. And so we really get some great objective data that helps us kind of determine where the deficits lie in the overall movement or with strength and stability and things like that. And it's a great way for us to assess the risk for injury. Or let's say, for example, you've had an injury, you rehabbed back, or you're getting back on track and you're like, I don't know if I'm ready to go back to skiing, or I don't know if I should go back to running. DorsaV is a great tool that we can use to further assess that as well. And you get this really cool kind of graph analysis. It's got all this really incredibly nerdy data that we all love to interpret. And so it really gives us a great perspective on the right leg versus the left leg. And it helps us to really break things down as well. So if you do DorsaV, you get a printout like this, and we go through all this with you and kind of break down all that info and basically explain to you what it means. Because just looking at this looks probably pretty intimidating, but DorsaV has been a great tool for us to have. And it's great to really assess how you're moving. All right, I'm gonna let Maddie jump back on here. She's gonna talk about ASTIM and a few other things.
All right, hey guys. So ASTIM, it's Instrument Assisted Soft Tissue Mobilization. Some of you might have heard of gua sha or Graston, or referred to as scraping or tool work. It's all pretty similar. They're just different tools. This is a picture of the couple of tools that we have in our clinic. So gua sha is usually more of like a stone tool. Graston is definitely a metal tool. Scraping is just a general term, along with tool work. Instrument assisted soft tissue is helpful. As you can see, all the different curves and bevels of the tools, it kind of matches up to the contours of our body, our natural shape, which can help redistribute the force of soft tissue work. It can also help with PT's hands. It's much easier on our little joints. It's common for PTs to get some arthritis in their hands from doing so much soft tissue. So this kind of takes the compression off of our joints, especially in our thumbs. And again, like those contours of the tools help to get into some awkwardly shaped parts of our bodies, like around our little kneecap is kind of difficult to get to. Some benefits of soft tissue massage. It's the same as if with hands as it is with tools. It's going to help stimulate the healing process. It's kind of cool and nerdy, but most of the cells in your body respond to a mechanical stimulus. So when we're mobilizing the soft tissue, your cells are having responses. super nerdy stuff, super fun, but it can help stimulate that healing process. It can increase blood flow to the area, which is really important to get new nutrients in there, especially if we're being kind of stagnant. If we're in pain and we're not moving as much, our tissues are just kind of sitting there, and it helps to kind of push some new fluid, some new blood in there, get some new stuff happening, and start kickstarting that healing process a little bit. It also helps to prime your muscles for increasing your muscle length. So I like to stretch before I do soft tissue and then afterward. And usually you get a little bit more afterward, and it helps to really kind of take home when we have collagen fibers that are misaligned. So if we're stretching, trying to get them straightened out, and then we're mobilizing them, and then we're stretching again, I think it has a little bit more of a lasting effect. It can also decrease pain. Of course, some people really enjoy tool work, or some people really just don't tolerate it and they do better with soft tissue mobilization. Either is fine. Sometimes the tools can just help feel a little different vibrations. It's good for evaluation and for treating. I'm Graston certified for level 1. And it's a great tool. I think it's a great asset to therapy. I like to do soft tissue with a lot of people. Usually gets them relaxed, decreases their pain, gets them ready to look into more of those problems. So now we're going to talk about some exercises. So first off, we're going to talk about some stretches. So this is a good way to stretch the quads, especially if you don't tolerate just the basic quad stretch of pulling your heel towards your butt. So you can sit on the very edge of your bed, and then you'll bring one knee up to your chest and slowly lay backwards, and you just kind of let your other leg hang. And if your quads are really tight, you'll feel a stretch across your the front of your thigh. With this one, you might also feel some other things. You might feel some tension in the front of your hip if your hip flexor is really tight, which is common with everyone sitting these days. Or you can feel some stretching on the outside of your thigh or the inside. Pretty much, it's going to stretch the musculatures around your knee. Just whatever needs to be stretched the most, it'll kind of hit that first. Stretches, usually we like to hold them for 20 to 30 seconds to actually see some tissue elongation. And then stretches are great to do daily. I know that's kind of lofty. I like to say daily because people will usually do them a little more often then. And if we're more consistent, we're definitely going to see more progress with that. Okay, next up is hamstrings. So this is one way to do a hamstring stretch, is if you sit on the edge of a chair with one of your legs straight, and then kind of lean forward towards your toes. We want to be careful to kind of keep that natural curve in our back. We don't want to be super hunched over here because then we can hurt our spine a little bit, but you should feel a stretch in the back of your thigh. Another alternative is just the classic bend down to touch your toes. But this is a much more tolerable one. Or if we're working at a desk, we can just kind of pop that heel out and lean forward. If we're on a Zoom call, maybe someone won't notice we're stretching while we're doing it. So that's a really good one too. And then our final stretch here is talking about the calves. So this is a good calf stretch. Hands on the wall, step the foot that you're trying to stretch back. Keep a straight knee and you're going to lean forward. So right now, Jen in this picture is stretching her right calf here. And same thing, 30 seconds. You'll feel a deep stretch here. If not, you can try and bend your knee and hit that soleus muscle we talked about that lies deep, that doesn't quite cross the knee joint. So if we bend that knee, we'll put that big gastroc on slack and we can get to that deeper tissue. All these muscles that we talked about with stretching are the ones that are the main ones that cross our knee joint. And sometimes getting some increased tissue length in there can really help with that joint space, especially if we have OA, if we have tight muscles, just pulling those bones together even more, that can really increase our symptoms sometimes. Okay, now we're going to talk about some strengthening exercises.
All right. So let's talk about the foundation, like I was alluding to before. So the exercises that we're going to go over, keep in mind, these are very general exercises. And so they may or may not be appropriate for everyone based on what you have going on. So keep that in mind, that these are just kind of a general overview. But these are some of the foundational exercises that we like to use. And again, if you have a house with a poor foundation, things don't tend to usually go well. So the first one we like to do is called a straight leg raise. And so basically you were just laying down kind of, you can either lay propped up on your elbows like I am in this picture here, or you can lay flat on your back either way. Being propped up a little bit more does put a little bit more emphasis on the quad muscles. But what you're trying to do with this one is keep the knees straight as you're lifting the leg up and down. And so it's very easy to kind of go over the top with this exercise. Basically, when you're lifting your leg, you really don't need to go any higher than the opposite knee that you have bent there. So this is a great exercise that's working on the hip, but also emphasizing more of the quadricep muscles too. If you have a painful knee, because you're keeping the leg straight, this tends to be a little bit more comfortable. It still can be pretty challenging to do. So keep that in mind as well, but it can be a little bit more comfortable for the knee. So that is the straight leg raise. The next one is the bridge exercise. So again, when we're talking about the knee, we need to make sure that we strengthen the hips and the glutes too. So the bridge is a great exercise for that. Just laying down with your knees bent. I like to cue my patients. I say butt belly bridge. That way you're engaging your glute muscles, you're activating your core, and you're doing the bridge at the same time. So squeeze your butt, tighten your belly, and then do that bridge and lift your hips up into the air. And with all these exercises, you want to make sure that you're moving nice and slowly, that the muscles are actually getting a chance to work. If you're moving really quickly through the motion, then you're kind of using more momentum and you're really not isolating those muscles as well as you can. So side lying for the hip. So this is going to strengthen the muscles on the outside of your hip, which again is very important to helping to control the knee and the leg. So you're going to lay on your side. And I kind of call these the old Jane Fondas, where you just are lifting your leg up and down. The key with this one is you don't have to lift very high, but more importantly, you need to keep your pelvis and your hips stable. So as you lift the leg, you should not feel your pelvis roll backwards. You should almost kind of want to sort of bias your pelvis into being a little bit more forward. But this one you should feel on the side of your hip, even kind of on the back side of your hip a little bit too. But if you feel it in your quad muscles in the front, then you're probably tipping your pelvis backwards and you're not even using the right muscles. So this one for sure, you have to make sure that you really are staying on that hip. But again, a really important one for just building that foundational hip strength. Long arc quads. So this is basically, some people know this as like the leg extension, or similar to like the knee extension machine that some people do at the gym. This one you can do just sitting in a chair, start with the knee bent, and then you're just slowly going to kick the leg out straight, squeeze and hold through the quad muscles for, 3 to 5 seconds. And then again, lower that knee back down nice and slow. Slower the better when you're doing an exercise, particularly like this. So, sometimes this can be problematic in certain knee conditions, or if you have certain types of pain. But this one is a great one for just building some of that quad strength through there. And great for range of motion in general too. If you're having issues bending and straightening the knee, this is a great one for that. And then terminal knee extension, which basically is just a fancy word for when you're standing, straightening your knee. And so One of the things that I like to do is we use this little ball that we put behind your knee. You can put a ball behind the knee. You can use a pillow. It's more so just kind of like a tactile cue or just some feedback to kind of give you a little bit of a target. But you basically stand kind of right at the wall. Your feet are going to be out just a little bit away from the wall. You'll start with your knee bent, and then you just kind of squeeze through your quad muscles until your knee is straight, and then kind of relax out of that. So again, just really working on tightening those quadricep muscles through there. And now we have progressive exercises. So those exercises, again, are pretty foundational, tend to work pretty well if you're kind of in an acute type situation where the knee is pretty bothersome. So the next set of exercises we're going to talk about, these are definitely more higher level type things. And so these are all things that you would want to do, if you're not really having a lot of knee pain, but maybe you're trying to prevent injury, or maybe you're just trying to get into a good strengthening program, then these are the exercises that you would want to do, or consider doing at least. But again, if you're having any sort of pain or limitations or things like that, you have to be cautious because these might not be appropriate depending on your particular issue. So again, this is a hamstring bridge. So just a little bit of a bridge variation. So instead of having your feet on the floor, on your bed, things like that, you are basically just putting your heels up on the chair. So if you've ever done this one before, this is a tough one. So this one, you're going to definitely feel through the hamstrings. You'll feel through the glutes. It really steps up the hip strengthening a little bit. And it can be very, very challenging. So probably not appropriate if you're in an acute amount of pain, but if you're looking to build some good strength, this is a great exercise for that. So it's same as the bridge too. Heels are on the chair. You kind of press your heels down. So you're lifting your hips up. As Maddie is showing in this picture here, she's using both feet. If you want to make it really challenging, then you can progress to doing it with one leg, which is tough, but is a great strengthening exercise. A wall sit. Everybody probably remembers these from, like junior high gym class, I'm sure. We mention wall sits and people kind of giggle, but it is a great exercise to work on quad strength, glute strength, and endurance and stability of the knee too. So stand with your back to the wall. You're going to want your feet out away from the wall a little bit. Again, just to give yourself a little bit of room to squat down there and not put a lot of strain on the front of the knee. And then this one, the beauty of it is you just kind of work your way down the wall to where it feels comfortable. So whether you are, leaning against the wall, and whether you barely squat down, or maybe you squat down like Maddie is here, kind of at that 90-degree angle, it doesn't matter. You just go to where it's comfortable. And again, get into that position and then kind of hold it. Typically, depending on how your strength is, 15 seconds, 30 seconds. Some people can go up to a minute, some people can go longer. But this is a great one to really work on glute strength and stability. Step down. So this is another one where we're looking at hip control and working on strengthening the quads in a little bit of a different way. So just using a step, if you have steps at home, you're basically just going to stand with your leg on the edge of the step, and you're just going to lower yourself down nice and slow. So on that opposite leg, you're just going to kind of touch your heel down to the floor and then stand right back up. So again, the emphasis with this one is kind of stepping down nice and slow, nice and controlled. And again, making sure that as you are stepping and lowering that leg down, Maddie has a great demo in this picture here. Her leg is nice and straight. You want to keep your knee kind of lined up over where we say the second toe is. So just your knee is not falling inward. That way you're really working those hip muscles. But this is a great one. Can be very problematic in people who are acutely painful, especially if steps is an issue. So use caution. Again, a little bit higher level strengthening for this one. And then the lunge. So again, same thing applies with the lunge. You don't have to go down real far. You just go to where it feels comfortable. And again, you're just not wanting that knee to fall inward. Keep that knee kind of lined up where that second toe would be. and again, kind of really driving down through your heel and using your glutes too. So it doesn't have to be a real deep lunge. It can be, through only just a small little bit of range of motion. But again, this one can be pretty challenging if you're doing it correctly. And then if you want to progress the lunge, then you can do what we call a split squat, which is basically just doing a lunge, but you are putting one foot on a chair instead. So this is really putting a lot of a challenge to that front leg there. So this is definitely a high level strengthening thing, not one that we would recommend doing when you're acutely painful. So this is one, if you're again wanting to add some new exercises into your strength training routine, this is a great one to help build that hip and glute and knee strength with this one. Okay, so that's kind of a general overview of a few exercises that you can start with, some that may be appropriate to progressing to, but again, depending on what's going on with your knees, some of those might not be ideal for you as well. So if you are questioning, what is best for your knees at this point, after everything we've gone through, if you just have more questions or you feel like maybe you do need to have the knee evaluated, what we're offering is a healthy, stronger knee evaluation. And so what that entails is we would do a thorough exam, thorough assessment of the knee, do our special testing, kind of really get a good idea of what's happening in that knee joint. Like I said, our clinical impression of what we think is going on in there, looking at how you're moving, how we need to optimize that, whether you're a skier, a runner, whether it's just squatting down to pick up your grandkids, whatever movement that you're having problems with, we can analyze it. And so taking a thorough look at that and then really determining what are the best exercises for you at this particular point where you are, whether you're having knee pain, whether you're dealing with an injury, whether you're looking to prevent pain or injury. We can give you very specific exercises based on what you want to be able to do, based on the activities that you want to be able to get back to doing. Or if you just want to perform better, if you're an athlete already and you're not really having any issues, but you're like, man, I feel like I need to get so much better at doing this, we can help you do that too. So giving you some specific exercises based on what you need to help to be able to do the things that you want to do. And then also, recommendations for in the future of things to progress to, things to watch out for, ramping up that activity. So and then you're not overtraining. Those are all things that we could go over with you. And of course, addressing any specific questions or concerns that you have. So all three of us here, Maddie, myself, and Jenny, the other physical therapist, one of the things we do constantly with patients is educating people on things that are appropriate, that type of thing, prevention, just as a whole, how you can move better and move safer too. So addressing any questions or concerns that you have, we do that as well. So if this sounds like something that you would be interested in doing, if you contact our office in the next 10 business days, we will cut you a deal on this one and do the whole evaluation and everything, which is typically a $200 value for $50, which if you're having any kind of knee pain, any issues, any limitations, get it evaluated, because there's so many things that we can educate you on. There's so many things that that we can provide to you and kind of get you going down the path that you need to be going down, whether it's dealing with pain, dealing with injury prevention, all those types of things. We can help you do that. And so we certainly want to put that offer out to you. So if it's something that you're interested in, you just have to contact our office in the next 10 days. And we can get that set up for you. We also do accept major insurances if that's something that you are possibly considering and questioning if we can bill that through insurance. That's something that we can talk about as well. But we do accept all major insurances too. So it's a pretty good deal for everything that we offer and everything that we can help you achieve with the goals that you have for moving better and moving with less pain too. So if that's something you're interested in, you can call our office. The phone number is there. Otherwise, you can go onto our website, which is resolveptben.com. There's a link that you can click in there that says request appointment, and you can request it through there, or you can email us at our email as well. So any one of those ways you can contact us, reach out to us, and we will be happy to get you on the schedule, and we can take a look at everything and get you down the path that you need to be going down. So it has been a pleasure to have all of you with us this evening. Thank you so much for hanging on. I know that was a lot of information to cover. The knee is just something that we could talk hours and hours and hours about, but we tried to keep it as thorough and concise as possible. So thank you very much for being with us. Let us know too if you have any other questions or concerns that you would like us to address. And again, too, if you're interested in coming into the office and having us take an in-depth look at your knee and kind of what's going on, please reach out to us either via phone, through the website, or via email, and we would be happy to see you here in the office and get to see your lovely faces in person. So again, thank you guys so much for being